Hello, future physicians! Welcome back to our USMLE Step 1 Prep Series. Today, we're exploring a case of a 19-year-old man who collapsed with severe upper back pain. Let's get started. A previously healthy 19-year-old man is brought to the emergency department 30 minutes after he collapsed while playing softball. He had severe, sharp upper back pain prior to the game. He is 196 centimeters, or 6 feet 5 inches tall. His temperature is 37 degrees Celsius, pulse is 130 per minute, respirations are 24 per minute, and blood pressure is 80 over 50 millimeters of mercury. Physical examination shows pallor and no jugular venous distension. Breath sounds are clear. The carotid pulses are weak. A grade 4/6 late diastolic murmur is heard at the lower left sternal border. Which of the following is the most likely cause of this patient's cardiac findings? Let's break down the key points in this patient's case. First, he collapsed with severe upper back pain. Second, his vitals show tachycardia and hypotension. Third, the physical exam reveals pallor, weak carotid pulses, and a late diastolic murmur. This clinical picture suggests an acute cardiovascular event. Let's evaluate each option. Option A, atrial septal defect. An atrial septal defect typically causes a systolic murmur and wouldn't lead to collapse and hypotension. Option B, mitral stenosis. Mitral stenosis causes a diastolic murmur but is usually associated with chronic symptoms, not acute collapse. Option C, papillary muscle rupture. Papillary muscle rupture can occur acutely after myocardial infarction, leading to severe mitral regurgitation and cardiogenic shock. However, the murmur described doesn't fit. Option D, perforated tricuspid valve. A tricuspid valve perforation would cause a systolic murmur and is associated with right-sided heart failure symptoms, not collapse and hypotension. Option E, stretched aortic annulus. This is the correct answer. A stretched aortic annulus can lead to acute aortic regurgitation, causing a late diastolic murmur, hypotension, and collapse. Therefore, the most likely cause of this patient's cardiac findings is a stretched aortic annulus. And that's how you tackle a USMLE Step 1 question on acute cardiovascular events. Always consider the hemodynamic changes and physical exam findings. If you found this video helpful, please like, subscribe, and hit the notification bell for more exam-crushing content. See you next time.